Wash my hands. I have my name badge present. I have my stethoscope and all my supplies are right there. Wash my hands. Hi, my name is Marissa. I'll be assessing you today. Can you tell me your name and your date of birth?
Davide Serpilli, 082098.
Perfect. Can you tell me the month and the year?
It's December and it is 2019.
Perfect. Can you tell me where you are?
Winter Park, Florida.
And can you tell me what brings you into clinic today?
A physical.
Perfect. All right. So I'm assessing his posture and position. He's sitting in a relaxed sitting position, shoulders slightly rounded forward. So a good position would be him rounding back, perfect, neutral spine. I'm gonna have him walk to the chair and back, and I'm gonna assess Davide's gait. So can you walk to the chair? All right. Good gait pattern, good speed, no imbalances noted, and he doesn't need any assistance devices to walk. He can sit back down. So I'm gonna assess Davide's speech. So in having this conversation with Davide, he has good articulation, he's clear, easy to understand, he does not have any slurs or stutters. Davide, what's your primary language?
English.
Okay, and primary language is English. And in talking with Davide, his responses are appropriate to the questions that I'm asking. Next, I'm going to be assessing Davide's vital signs. So I took Davide's blood pressure. It's 110/73. Heart rate is 82. Respiration's 18. Pulse ox 99%, and temperature is 98.2. Are you in any pain?
No.
Okay, so no pain. Now I'm going to assess Davide's skin and nails. So skin color is appropriate for ethnicity. Normally, I would roll up the sleeves, assess the chest and everything else, but for the purpose of the videos, we're going to keep him in the clothes that he's wearing and not change him into a patient gown. So skin is appropriate for ethnicity, no bruising, no scarring that I can see. Skin is dry and warm. No edema, no erythema. Put your palms for me. All right. Some small, less than 1 centimeter macules, moles, noted to his arms, his face. Does have one to the right ear. Turgor is brisk, return to original position. I'm now going to assess his nails. So nails are well manicured, they're clear, they're convex in shape, no splinter hemorrhages, no yellowing, no thickening of the nails noted. So those look good. Could also assess cap refill again at this time. So cap refill is less than 2 seconds. Perfect. All right. Next, I'm going to assess the face and hair. So face, I'm also going to do facial features are symmetrical. Again, temperature is warm, dry, no edema or erythema. I don't see any scars, no bruising, no lesions. Skin is intact. Like I said, moisture, skin is dry. I'm going to assess the scalp for any masses. So no masses, no infestations, no indentations, any tenderness?
No.
Okay, and no lesions that I can see. Okay, and no scars. Next, I'm going to assess the lymph nodes. So I'm going to start with the parotid, the preauricular, postauricular, the occipital, tonsillar, submandibular, submental, anterior cervical chain, Oh, I feel good. That way. Posterior cervical chain. Okay. Supraclavicular. So, known lymph nodes palpated. Okay. Next, I'm going to go on to the eyes. So first I'm just looking at his eyes. I don't see any preorbital edema, no bruising, no lesions around his eyes, no crusting around the eyelashes. I'm just going to look at your eyes. Conjunctiva is pink and moist. Sclera is yellow, no yellow. Sclera is white, sorry, no yellowing to the sclera. Okay. So the first test that I'm going to do on his eyes is going to be the corneal light reflex. So I'm going to have Davide look straight at my nose. I'm going to shine the light in your eyes. Just keep looking at my nose, okay? Okay, and now look at the light. Perfect. So the reflex of the light is in the center of both of Davide's pupils, which is a normal response, which is what I want to see. Next, I'm going to do the 6 cardinal positions. This is assessing cranial nerve 3, 4, 6, and the ocular muscles. So just follow this for me, Davide. Perfect. Okay. Now I'm going to assess the cover-uncover test. So just keep looking at the speculum of this object. Perfect. No movement or deviation to either pupils. Again, no movement or deviation to either pupils. Keep looking at this for me. Pupil size is 6 bilaterally, 6 millimeters. All right. Just keep looking straight at my nose. Okay, pupils are both reactive. Pupils both reactive. So pupils equal round. Both of them are reactive to light. And now follow this object. I'm going to bring it towards your face. And both reactive to accommodation. So that was Perla. Next, I would do the red light reflex. I'm not going to do it, but I'll verbalize what I would do. I would dim the lights. I would use my light, and I would shine it in Davide's eyes about a foot apart, slightly at an angle, and I would want to see a red light reflecting from both of Davide's pupils. And that would be a normal response for red light reflex. Next, I'm going to look into the ocular fundus of Davide's eyes. So I'm going to switch this. Sorry, there's going to be bright light. If I can get this. Okay. I'm just checking really quick that it's in the right position. Okay. Okay. You can see the ocular fundus. No opacities. Optic disc is a pale yellow. Optic disc margins are clear, and you can see vessels are present. So I'm going to switch and look at the other eye. Sorry. Okay. Again, no opacities present in the ocular fundus. Optic disc is pale yellow, margins are clear, and vessels are present. Next, I'm going to be moving on to the ears. So I'm going to switch this out. If I can do it. Okay. So first I'm just looking at Davide's ears, not looking inside the ears yet, just for any lesions, edema, erythema, any drainage. So I don't see any of that. Same thing on this side. Color is appropriate, no erythema. A little bit red, but maybe he's just like a little bit nervous, you know. No bruising, no scars. Again, there's a small nevi, 1 centimeter to the right ear. So before I look inside, I'm just gonna palpate. Tell me if there's any tenderness or pain when I palpate, okay? Any pain?
No.
Okay. Now?
No.
Okay, so pinna, tragus, and then now palpating the mastoid process. Any pain? Okay. So now I'm gonna look inside Davide's ears. Okay. So I'm pulling the pinna up and back. Okay, some small fine hairs. No excessive cerumen, no lesions in the nose or scratches. Small amount of yellow wet cerumen, which is normal. Tympanic membrane is pearl gray. No fluid or bubbles behind the tympanic membrane intact. Ossicles are present. Cone of light present at 5 o'clock. And no drainage noted from the ear, no erythema or no edema. So now I'm gonna look at the left ear. Okay. So again, small fine hairs, a little bit of cerumen, yellow, moist cerumen. Tympanic membrane is pearly gray, no fluid fill bubbles behind it, no erythema or edema noted. Ossicles are visible. Cone of light is present at 7 o'clock, and the shape of the tympanic membrane is concave bilaterally. No scratches noted in the ear, no drainage bilaterally. So for the ear, we're done. I'm gonna look at the nose, but before. So now going on to the nose, just looking at nose's midline, no deviation, no lesions on the nose, no erythema, no edema around the nose. So just look up a little bit. Cover one of your ears with your finger. Part 2. Okay, so we were continuing with the nose. I was just examining the outside outer part of Davide's nose. So nose is midline. I'm checking for patency. So cover one of your nose. Inhale. Exhale. Okay, left ear is patent. Other side we'll do that on. Inhale. Okay. A little bit of congestion to the right ear. Alright, you can see that. Come look inside. Just gonna look inside. Okay. So nasal turbinates are pink, moist, and firm. No drainage noted. Nasal septum is intact, no deviations, no perforations. I did not see any nasal polyps. And like I said, no drainage from either of the nares. I'm just gonna palpate the nose and some of your sinuses. Tell me if any of that hurts, okay?
Okay.
Any pain or tenderness?
No.
Okay, so I was palpating the nose, the frontal sinus, and the maxillary sinuses. So no pain, no tenderness, no edema to any of those sinuses. The next thing I would do is assess cranial nerve 1, which is smell. And I could have some cinnamon available, and I'd ask him to tell me what that smells like. He may not exactly say cinnamon, but if he says it smells like a spice, that would be good. Maybe I would have rubbing alcohol, and he would describe that to me, the smell of that, maybe lemon. So that would assess for a sense of smell. Next, I'm going to do cranial nerve 5. So that has a motor component of it, which helps with biting and chewing, and then also a sensory component, which helps you sense dull sensations, sharp sensations, warm and cold sensations. So I'm going to have Davide lay flat on the examination table, and I'm going to palpate the masseter muscle. And Davide, I'm going to have you open and close your mouth while I do this, okay? Okay. Keep doing that, open and close. Okay, you can sit back up. Okay, no deviations. So to assess the sensory portion of cranial nerve 5, the trigeminal nerve, I'm going to have a dull object. This is what the dull object feels like. Okay, and a sharp object. This is going to be the sharp object. So I'm going to have you close your eyes, and I'm going to put these sensations on your forehead, your cheek, and your chin, and you just tell me if it's dull or if it's sharp. Okay?
Sure. Dull. Sharp. Dull. Sharp.
Okay, perfect. All right. Now cranial nerve 7 is the facial nerve. So I'm assessing symmetry to his face at rest first, which his face is symmetrical, and then I'm going to have Davide smile. Face is symmetrical, frown, puff cheeks, pucker lips, raise eyebrows. Perfect. So throughout these expressions, his facial symmetry is symmetrical. So that was cranial nerve 7. Now I'm going to do oral assessment next. So around his lips, there's no cyanosis or pallor. His lips are pink, moist, a little bit dry, but no fissures and no cracks to his lips. Next, I'm going to assess the buccal mucosa. Open your mouth for me, just looking inside your mouth. Okay. Buccal mucosa is light pink, no lesions, no erythema, no edema present. I'm going to check your gums. Okay, no erythema to gums. Sorry, you got it. Okay, no gingival hyperplasia, no bleeding to gums. Next, your teeth. Teeth are uniformly white. No missing teeth, no black or brown colors to teeth that could suggest dental caries. Next, I'm going to look at your tongue. Tongue is pale pink, no lesions, no edema, no erythema. Stick your tongue out for me. Perfect. And I'm actually going to have you close your teeth. And also no malocclusion or misalignment to his teeth. Stick out your tongue like this. Perfect. So that's testing cranial. I'm going to look under your, under your tongue. Frenulum intact. No edema or erythema to salivary glands under his tongue. All right. You can put your tongue back down. I'm going to look. Open your mouth again. Looking at the palate. So hard palate is pink, moist, and hard. No clefts, no lesions, no petechiae present. Soft palate is pink, moist, intact. No lesions, no erythema, no cleft. Stick out your tongue and say ah. Soft palate and uvula move symmetrically. Okay. Back of throat, no lesions, pink, moist, no cobblestoning present, intact. Tonsils are 1+ bilaterally, no exudate to tonsils, no enlarged crypts to tonsils, no lesions on the tonsils. So that's oral. Throat. Speech, I already assessed his speech. He has good articulation. Sometimes if the patient has a nasal voice quality, it could suggest allergic rhinitis or submucosal cleft, but Davide does not have a nasal voice quality. So now I'm going to assess TMJ. So open and close your mouth. Keep doing that. No subluxation, no deviation, no crepitus present. Okay. So now I'm going to do assess the neck. So neck temperature is warm, dry, skin color appropriate for ethnicity, no edema, no lesions, no nevi present, no scars or bruising present. Trachea is midline. Assess your thyroid. He's already looking up, but if he wasn't, I would ask him. He's swallowing for me, so. All right, assess the thyroid. You can look straight ahead now. I'm gonna assess the carotid, but before, I did not see any pulsations to his neck, no lumps to his neck. I don't see any pulsations where the carotid artery is. I'm making sure that I'm just palpating one at a time. Okay. Right carotid 3+. Left carotid 3+. Okay, I'm gonna auscultate for Bruy. No Bruy. Okay. No Bruy to carotid. So now I'm going to test upper extremity range of motion. So I'm going to have you shrug your shoulders up. Okay, now I'm going to have you shrug them down. Up against resistance. Okay, good. You can shrug them back down. All right, hands to shoulders. Hands out. Palms up. Palms back down. Fist. Fingers out. Fingers closed. Okay, try to wrist up. Wrist down. Wrist in. It's a little bit hard. Perfect. And then wrist out. Perfect. Okay, you can put your arms back down. All right, now I'm gonna listen to his heart. So, ape to man is how I remember. Aortic, pulmonary, Erb's point, tricuspid, and mitral. So, in real practice, I would not listen over close. I would listen under close. Okay, now I'm going to listen again with the bell. Okay, S1 and S2 present, rate regular. No murmurs, gallops present. And then cap refill, which I already assessed, but that's also part of cardiac. So cap refill brisk, less than 2 seconds. Again, cap refills brisk, less than 2 seconds. Now I'm gonna listen to his lungs, anterior and posteriorly. So inhale through your nose and out through your mouth, okay? Okay, lung sounds clear anteriorly, and now I'm gonna auscultate posteriorly. But lung sounds were clear to lung fields, all lung fields anteriorly, bilaterally. So now for posterior, it shouldn't tickle too much in the back. Inhale, and out through the mouth. Is it still ticklish?
That's a lot of breathing.
Almost done. Good for your lungs.
Sure.
Three more. Perfect. Okay. Lung
Cool.
sounds clear bilaterally to posterior as well. And that is it.